Welcome to Nonotuck Resource Associates training on two people receiving services in the same home. Why is this training necessary? Two people receiving services in a home may lead to some unforeseen challenges. These could include DDS and AFC requirements, compatibility in respecting differences, restrictive practices, service provision and practices, and provider burnout. DDS and AFC requirements. For DDS, licensing requirements need to be met for both people. Many of those are presented later in this training. For AFC, funding guidelines limit 2 level 2 people maximum per household. And for both DDS and AFC, if 2 or more potentially matched or supported people or supported by different provider agencies, the people served, guardians, DDS, and other stakeholders must be made aware before any movement is considered and at all steps in the process. Compatibility in respecting differences. Each time any person is added to a family, there's an increased chance of 2 or more people getting along. The 2 people receiving services should be compatible and willing to respect each other's differences. The 2 people receiving services should be willing to live together, and all members of the household should be compatible and willing to respect everybody's differences as well. Restrictive practices. If one or both people receiving services have restrictive practices in place, it could affect the other. DDS requires that we notify the other person or guardian if a restrictive practice could affect the other. For example, if one person requires door chimes, it could affect the other person. If one person requires locked cabinets, that could limit access to whatever's in the cabinets to the other person. And of course, locked food could be an issue. Service provision and practices. 2 people receiving services in the same home can complicate service provision and practices, including safety measures. DDS requires that everybody be able to evacuate the home in 2.5 minutes or less during fire drills or emergencies. DDS and the EESP requires a description of both people and how they're going to evacuate safely in emergencies and requires ongoing monitoring. There could be differences in home alone time between the 2 people. There could be differences in community alone time with the 2 people. 2 people could double or even increase at a higher level the number and intensity of medical appointments. That each person could have different skill levels and needs. Each person could have different accessibility requirements. There could be water safety requirement differences. There needs to be the ability to store medications. And, of course, each person could have differences in leisure community activity preferences. Provider burnout. Supporting the needs and preferences of one person can be at times a challenge. More than one person increases the likelihood of ongoing challenges. With our providers, burnout can be an issue. So, as usual, we need to monitor, identify, and support our providers. Scenario 1. John and Paul have been matched with a young couple, the Manfords, living in Cambridge. Their home is on the 2nd floor of a duplex. The Manfords have 3 dogs and 2 children under the age of 5. What are some of the complications you may experience with this placement? Please pause and discuss. Scenario 2. Alice and her husband John are both level 2 AFC people receiving services from another agency. They live with their daughter's family, Martha and Jane Johnson, in a large rural home. Nonotuck provides wrap services to Jane Johnson's mom, who, with her provider, has suddenly become homeless. The Johnsons would like to have Jane's mom move into the home with her provider. What are some of the complications you may experience with this placement? Please pause and discuss.